CNA Care Plan Implementation. Welcome to the quiz. Question 1. What is the proper technique for counting a resident's respirations to get an accurate rate? Option A. Count for 30 seconds and multiply by 2, without the resident being aware, after pretending to take their pulse. This prevents them from altering their breathing pattern. Option B. Ask the resident to take deep breaths so you can count more easily and get an accurate rate. Option C. Count for 15 seconds and multiply by 4, as this is the fastest method. Option D. Tell the resident you are going to count their breathing and watch their chest rise and fall for 30 seconds. The answer is A. Counting respirations discreetly after taking a pulse gives a more accurate rate. Option A is correct because residents may alter their breathing if they know it's being counted, so counting discreetly after taking a pulse gives a more accurate rate. Option B is incorrect because asking for deep breaths alters the rate. Option C is incorrect because 15 seconds may be less accurate, especially if breathing is irregular. Option D is incorrect because telling them can change the rate. Question 2. A resident is crying and tells you they miss their deceased spouse terribly. What is a therapeutic response that validates their feelings? Option A. Change the subject to something happier, like the upcoming activities, to lift their spirits. Option B. It sounds like you really love them and the memories are strong today. Grief can hit us at unexpected times. Would you like to tell me about them or look at some photos together? Option C. Don't be sad. They're in a better place and wouldn't want you to cry. Option D. It's been a few years. You should be over it by now and focus on the present. The answer is B. Validating grief and offering to listen is therapeutic. Option A is incorrect because it avoids the emotion, which may be needed. Option B is correct because it validates the resident's feelings and offers an opportunity to express grief. Option C is incorrect because it offers platitudes and discourages expression. Option D is incorrect because it dismisses their feelings and is judgmental. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed, no fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 3. You need to transfer a resident from the bed to a stretcher. How many people are generally recommended to perform this transfer safely? Option A, 2, with one person at the head and one at the feet, using a draw sheet to slide the resident. Option B, at least 3 or 4, depending on the resident's weight, level of immobility, and ability to assist. One person should be at the head, one at the torso/hips, and one at the feet/legs to coordinate the move, ensure proper body mechanics, and prevent injury to staff and resident. Option C, 1 if you use a gait belt and the resident can bear weight and pivot. Option D, 1 if you use a mechanical lift, you can do it alone. The answer is B. Multiple staff are needed for safe manual transfer to a stretcher. Option A may be possible for a light resident, but generally more are needed for safety. Option B is correct because transferring a dependent resident to a stretcher requires multiple staff to ensure safety and proper body mechanics. Option C is incorrect because a one-person pivot is for transfers to a chair, not a stretcher. Option D is possible with a lift, but the question asks generally recommended, and for manual transfer, multiple people are needed. Question 4. When a resident is on aspiration precautions, which of the following food and liquid textures would be safest for them? Option A. Nectar or honey-thick liquids and moist, ground or soft foods that form a cohesive bolus, like mashed potatoes, pudding, or minced meat with gravy. These are easier to control and swallow. Option B. A whole steak with a glass of champagne, as long as they are sitting upright. Option C. Thin liquids like water and juice, and solid foods like steak and bread. Option D. Foods that easily crumble, like dry cake, crackers, or cookies. The answer is A. Thickened liquids and cohesive foods are safer for residents with dysphagia. Option A is correct because thickened liquids and moist, cohesive foods are easier to control and less likely to be aspirated. Option B is incorrect because steak is hard to chew and champagne is a thin liquid. Option C is incorrect because thin liquids and dry solids are high risk. Option D is incorrect because crumbly foods can fragment and cause choking. Question 5. The purpose of a waist restraint or belt restraint is to: Option A. Prevent a resident from falling out of a chair or wheelchair. It must only be used with a doctor's written order, released every 2 hours for range of motion and toileting, and checked frequently for skin integrity and circulation. Option B. Punish a resident for trying to get out of bed or for being disruptive. Option C. Help a resident maintain good posture while sitting in a wheelchair. Option D. Keep a resident confined to a chair for the staff's convenience so they don't wander. The answer is A. Restraints are only used to prevent injury with strict protocols. Option A is correct because restraints are only used to prevent injury when other measures fail and they require strict protocols. Option B is incorrect because restraints are never for punishment. Option C is incorrect because posture is not the purpose. Option D is incorrect because restraints are never for staff convenience. Question 6. A resident asks you to go to the bank and cash their Social Security check for them. What is the correct response? Option A. Explain that you are not allowed to handle a resident's money or personal finances. This is against facility policy and could be considered financial abuse or exploitation. Offer to notify the social worker or business office who can assist them with their financial needs. Option B. Take the check and give it to the nurse to handle, as the nurse can make better decisions about these matters. Option C. Agree to do it as a personal favor to help them out, as they seem trustworthy. Option D. Tell them you'll do it on your lunch break and bring them the cash. The answer is A. Handling a resident's money is a boundary violation and could be considered financial abuse. Option A is correct because handling a resident's money is a boundary violation and can lead to accusations of financial abuse. Option B is incorrect because giving it to the nurse also involves handling and is not appropriate. Option C is incorrect because it involves handling money. Option D is incorrect because it involves handling money. Great job! Don't forget to subscribe. Bye.